from Cave Creek, Arizona, business called MSK Guide.
MSK stands for musculoskeletal, and GUIDE is an acronym for Guided Ultrasound Injection Diagnostic Experts.
You are working with a variety of people, patients in the Western way of life, providing them help for joint issues in particular. Is that an oversimplification?
That is our only niche. We do one thing. We look at joints and the moving parts using diagnostic ultrasound, which is the same ultrasound that you would use to look at a baby or a heart. We're using it in the application of seeing the joints in motion, in real-time dynamic imaging. And our treatment process is performing regenerative therapy into the joints using the ultrasound as our navigation so we can clearly see where the injection is being placed. We use specifically pure amniotic fluid, which is also known as amniotic allograft. It is amniotic fluid that comes from the amniotic sac of a newborn baby. There are no live cells in the fluid at all. There are no fetal or maternal cells, no DNA.
Right.
It's not stem cell. What they do is extract out the growth factors, anti-inflammatory markers, and all of the healing components that our bodies already produce to heal, only this is at a brand new, very powerful level. And the power of the amnio, along with the ultrasound navigation, is really what our secret recipe is, and this is what delivers us the successful outcomes that we have.
Your patients are whom? You're in Arizona, which is country that, especially in the wintertime, gets busy with a lot of people that show up, bring their horses, rope a lot. There's a lot of rodeo cowboys go through. Who are your patients?
Our patients are really specifically the ranching, farming, and Western sports communities.
In the ranching, farming, and Western sports community, time is a very important factor. Ranchers, farmers, they have a schedule. When it's time to harvest, when it's time to spray, whatever, it's time to get it done.
Right.
Ropers, barrel racers, bulldoggers, whatever, bareback riders, when it's time to go to the rodeo, it's time to go to the rodeo. How do you get around that?
We treat every patient in one visit. First with a diagnostic ultrasound, so we're able to really assess what's going on in their joint. And then we perform the treatment all in the same day, the injection. The main thing that we want to be able to do is to help those patients that are not surgical candidates to delay surgery and a lot of times just put it off altogether. You don't want to take 6 months of downtime or more to go in and have a replacement done. If you are at the point where you've expired on your steroid or cortisone shots, they're no longer helping, and you haven't resigned in your mind to go in and have a replacement, that's where we come in. It's a regenerative process. The injections that we do take a few weeks to work, but create a very healthy environment where they're placed.
Right.
It signals the body to say, oh, what's going on over there? We want to come in and join that party, if you will. So in addition to putting in the amnio, now your body is sending its own healing cells into that area, and that's what expedites the healing process. It's not a quick fix. It could take a few weeks. After the injection, the downtime is about 10 days. We used to say 2 weeks, and then the physician and I would look at each other and say, he's not going to wait 2
Yeah.
weeks. Who are we kidding?
Yeah.
Even 10 days is asking.
If you want a rodeo cowboy to wait 2 weeks, tell him it's going to be 6 weeks to heal.
Exactly.
That's the best way to get them.
Well, that's true. We're learning that. But it's worth it for the longevity that you get out of, on the back end.
Right.
So 10 days, do your normal day-to-day routine, but nothing too rigorous to put those joints under duress for about that time.
MSKguide.com is the website if you'd like to know more. Rachel O'Grady joining us. MSK Guide is the business, and we're proud to be able to tell you about it this afternoon on Western Sports Roundup.